Welcome back to Back in Motion Health Talk, the podcast that brings you relevant healthcare information for the Baton Rouge community and beyond. I'm Dr. Justin Walbom, and today we're tackling a topic that affects every single one of us, health insurance. It's something we pay for, we rely on it, and let's be honest, it often leaves us with more questions than answers. So today, we're talking about it. What health insurance actually does well, and where it can get in the way of quality care. So, let's get to it. So, let's give credit where credit is due. There are some things that health insurance does right, especially when it's functioning the way it was intended. So the first thing is protection from catastrophic costs. For the most part, health insurance is a fantastic product if we're talking about catastrophic events. These are severe injuries, life-altering illnesses that require extensive care. So if you need surgery or your child develops cancer or other catastrophic injuries that need to be treated in an ER or with complicated procedures, insurance can save you from financial ruin. And a hospital stay can cost tens or even hundreds of thousands of dollars, and insurance does a good job to buffer that. And they do this through negotiated rates. So insurance companies have contracts with providers. They call this a network. That contract will be with a hospital or with certain providers, so that even if you have to pay out of pocket toward your deductible, you're paying a reduced or negotiated rate, not the inflated sticker price, if you will, of those services. So that is a good thing if you stay in network, but that does have its limitations, which we'll talk about here in a bit. So the third thing is preventive services. So insurance companies typically cover things like annual physicals, health screenings, vaccines, blood work. If you're proactive and you stay in network, often you can catch things before they become a big issue. There are limitations to these visits, and I want to be very clear on what this is. Insurance companies don't cover these because they're altruistic and have your health your health is not in their best interest. Remember that an insurance company is a business, and they are in business to make money for their shareholders. The reason why they cover things like annual physicals or health screenings is not because it's the right thing to do, but because under current law, it is required for them to cover these things. So be aware and be active when you're going to these things. Be proactive in knowing what you're looking for. And here's the secret to these services. If you go for an annual wellness check and you mention to your primary care provider that you're here for your wellness check, oh, but lately I've been having this pain in my knee. All of a sudden that visit goes from a wellness check or a preventive screening to an active case because of the way it's coded. So you can't just use that as a visit to address current needs under a wellness or preventive care visit. So be aware of what your insurance will cover, what the definitions are, which can also be confusing. And I will be having a podcast in the future with insurance experts or billers and coders, and we're going to delve into some of these nuances of healthcare insurance and how it actually works and how it can come back to haunt you if you don't know what your policy covers. So the next thing is access to specialists. Oftentimes, it's difficult to get into specialists. And if you are in network, most plans allow for referrals to specialists and diagnostic services. So cardiology, orthopedics, dermatology, endocrinology, all of these things require almost a pre-screening to get into because the services of these specialists are in high demand. And it is very helpful to have a primary care provider who will manage the network of providers to get you the best healthcare possible. One of the limitations of our healthcare system is it's a two-edged sword because we have specialists that are highly skilled in their area, but they get in their compartment and don't take into account the whole picture. So finding a quality primary care provider that can juggle the diagnoses and medications and coordination of care is essential. So don't let your primary care provider just be a referral gatekeeper to tell you which specialist to go to. They should also be managing all of the things coming from those specialists to keep you on the right track and to potentially catch any issues or conflicts from those specialists. They work together well and should have a good network and working relationship with each other. So let's talk about a couple of things where health insurance falls short. So now here's the part people feel they don't always understand, or it's not always explained how health insurance is going to limit their health care. Oftentimes we equate health insurance with health care, and that's not really the case. Insurance has limitations, and it directly impacts your access to care. You know, years ago, we had this discussion under the implementation of the Affordable Care Act, and that was this idea of death panels. And death panels, while they sound scary, have a probably a more realistic application rather than a panel of people at the insurance company that decide whether or not you die or you live and get the care that you need. More realistic is it would be more beneficial for you to have an MRI, but there's 15 hoops you have to jump through before you qualify to be able to get an MRI, or there's an expensive therapy or treatment that you need that would be more beneficial, but because it's more cost effective to do something less effective, the insurance company or the panel at the insurance company will require you to go through a more limited amount of care or a less effective therapy and prove that that won't work first. So understanding that your insurance company's really only interest is to limit the amount of money that they have to pay out for your condition it puts into perspective what you ought to be looking out for, which is your own well-being and your own health. And sometimes that's in direct conflict with what your insurance will cover. So remember that insurance doesn't equal access. Having insurance doesn't mean you'll get an appointment or get it fast or get the provider you want. Many people are insured but still underserved. So try calling for a specialist referral in an in-network based system. Well, you might wait weeks depending on the specialist. I've even made some referrals myself, and the nearest appointment they have is literally months out, up to 8 to 9 months, which is okay if it's not an emergency. But if this is a condition that could seriously affect your life and your ability to work or your ability to do the things that you enjoy for an extended period of time, it becomes a real problem. So the next term that I want to bring up, there's a couple of phrases that insurance companies use, and this is important for you as a policyholder to understand when they use this language. The first term that insurance companies use is medically necessary. So what does that mean? What does it mean when an insurance company says this is not medically necessary or this is medically necessary? Remember that it's not based on your needs, but on a cost and risk formula that the insurance and the actuaries that work there have made up. You may need therapy such as decompression or advanced diagnostics like a myelogram or an arthrogram or an MRI. But if it doesn't fit their definition or their protocols, they don't pay for it. So that's not medicine, that's accounting. And it's never a good idea to have an actuary dictating your care. Number three, or excuse me, the second phrase that I want to use is experimental. A lot of times insurance companies will use this phrase called it's an experimental service or experimental procedure. That doesn't mean that it hasn't been researched and that it's not effective. That means that it's too expensive for them to include in their formulary of what services they cover. So they use these phrases as kind of a psyop to convince you that it's not something that you need. And we see this a lot. There is tremendous research going on right now with stem cells, with photobiomodulation, with light therapy. with a lot of peptides and intramuscular injections of peptides, and how that affects the cellular activity in your body and the lengthening of telomeres and anti-aging stuff. But you walk into any anti-aging or aesthetics clinic, it is not covered by your insurance. Same thing with stem cells. Stem cells have been proven to be exceptionally effective at treating all kinds of orthopedic injuries, as well as some neurodegenerative conditions. And it's not up for debate whether these therapies are effective. The term experimental just means that the insurance company chooses not to cover them. And that's the phrase they use to say out of our coverage therapies. So those services are denied or excluded, not because they don't work, but because they don't save the insurance company money fast enough. So number 4 limitation is high deductible plans can create delays. And a lot of Americans, a lot of people have high deductible plans. That means you're paying thousands of dollars before your insurance kicks in. So what does that do? Well, it causes people to delay care, hoping that things will get better, or until it becomes a situation they just can't deal with. I deal with this all the time here at Back in Motion, where we treat herniated discs, and that can be an expensive condition if you're paying out of pocket, say at a hospital or at a pain management clinic, or if you are considering surgery. So instead of paying the deductible, because if you have a $10,000 deductible, well, that's a lot of money, and maybe it will get better. And this is the justification that people use, but that's not a good idea, nor is it in your best interest as a policyholder or as an individual. Your health is what you have, and the longer you wait for certain injuries, the harder it is to treat them and to get good results. And this is particularly concerning when it comes to things like cancer or stroke. I had a patient just not that long ago who was sitting in my office. Now, thank goodness, and we'll just be thankful that it didn't end up being a stroke, but they started having some stroke-like symptoms and said, well, if I go to the emergency room, it's going to be thousands of dollars, and I don't have that. And when they came into my office, you kind of give them that look like, what? And we screened them, and thank goodness all the diagnostics came back and everything was fine. But they delayed going because of financial concerns, because their deductible was super high. And that's never a good idea. So that is one of the limitations of insurance. And the next one also is kind of along that similar line, where we limit our choices because of what the insurance dictates. And that's this idea of being in network. Being in network isn't always better. In-network providers may be cheaper, but they're also working within tighter constraints. Remember that when a doctor or a provider enters into a contract with the insurance company, they're agreeing to follow the protocols and the dictates that policy limits. So just being in network means that the provider has to work within a framework. This gets back to that idea of the death panel, or at least healthcare by bureaucrat, and that may restrict the amount of care that you can get. Short appointment times, limited treatment options, things that require prior authorization, pressure to refer quickly or prescribe medications quickly, or sometimes, these things are limited, or limitations, and it ends up being more of a, you feel like maybe it's a cattle call, where you're just being pushed through a system rather than having adequate health care provided. So sometimes paying cash out of network actually gives you better, faster, and more personalized care, especially in certain specialties like chiropractic, functional medicine, regenerative health, even oftentimes with primary care providers. There are many providers now that are moving more toward concierge practices, rather than just a strict in-network insurance practice. So those are some topics we'll actually be discussing on future podcasts. So tune in for those. So this isn't just a rant. I want actually to be some information that you can take and actually be proactive with. So here's what you as a patient can do. The first thing is to understand your policy. Get to know your policy, know your deductible, know your network, know what doctors are in network, know what your plan covers and what it doesn't. A lot of times we as providers tend to make recommendations based off of what may be covered rather than what is necessary. If you're already aware of a therapy or you're already aware of a treatment that may not be covered and you bring it up to the provider, it may free up your provider to make recommendations outside of your insurance policy. Also, you should ask about cash rates. Some providers, especially independent clinics, offer cash prices that are lower than your copay or deductible would be. Don't assume insurance is cheaper. This is particularly true with hospitals that oftentimes work with you to make sure that things can be affordable, particularly if your insurance is, if you don't use your insurance or if your insurance isn't adequate. There are cash rates that you can negotiate for these things. Okay. Number 3 is get a second opinion. So don't let your insurance company be the final voice of your care. Ask questions, explore options, seek providers who prioritize your outcomes and not your policy. A lot of times it is extremely frustrating. It's not your doctor's fault. And I've talked with many colleagues that have the same feeling that they just feel handcuffed. Like, I can't recommend anything that's not covered, even though I know some great things that are. And in fact, some treatments that I provide here at Back in Motion are not covered by insurance. They're not deemed to be well, they're not in their formulary. And that's been a limitation from some providers in making referrals for things like peripheral neuropathy and things like that. So it's not always the doctor's fault because they're trying to make sure things fit inside that box. So if you can understand what your insurance company will do for you and what it won't do for you, it frees up you and your doctor to work more as a team to find the most appropriate care. Remember that you should, the last thing that you can do is invest in prevention. So insurance is great for emergencies, but it's not really designed for optimization. Your health, your energy, your longevity, they all depend on what you do outside of your insurance policy. So I like to equate our healthcare system is not really a healthcare system. It's a sick care system. It's a responsive system. Something goes wrong and we go to the doctor, or something goes wrong, we go to the emergency room. But that's not really the optimal way to be healthy. If we always wait for something to go wrong, then we're going to end up with problems. If I eat McDonald's every day, no offense, McDonald's, but if we eat McDonald's every day for breakfast, lunch, and dinner, it's safe to assume that we're going to end up with some metabolic issues. And so we're going to end up sick at the end of that experience. But it would have been a much smarter idea to have a balanced, healthy diet before and not eat McDonald's every day. But your insurance company is not going to pay for that. So remember to be proactive in your health care. Exercise, lifestyle, nutrition, proactive care, supplementation. So your primary care or your chiropractor or your nutritionist should be able to guide you through what supplementation you ought to be taking, how to improve your health so that you don't end up having to use your insurance for those emergencies. So remember that your health insurance is a tool, but it shouldn't be your blueprint for health. So use it when it helps, but don't let it limit limit your care. Explore your options. What you treat, how you heal, all of this is important. So I hope this has cleared up some confusion or sparked some new questions. So please hit the subscribe button. And if you've had a good or bad experience with insurance in your care, I'd love to hear about it. So you can send me a message or put a comment down below. So I'm Dr. Justin Walbom, and this is Back in Motion, real talk for real results. Until next time, stay healthy and stay in motion.